Domestic violence isn't just an argument with someone in your home that's close to you. It's the establishment of a pattern of coercive control by use of various means, by use of physical violence, sexual violence, by controlling food, telephones, other resources, money, through humiliation, through shaming, betrayal, belittling. And once violence has a presence in a home, it doesn't need to be repeated constantly to create fear and distress. There's often a pervasive atmosphere of threats and intimidation of violence, which means that life can be lived in constant dread or fear of violence. Domestic violence is the commonest form of violence against women in the world, and it is present in every society to some extent. To effectively address domestic violence requires taking coordinated actions across multiple sectors in a society. We need to reform legal systems, we need to transform the attitudes of law enforcement, we need to transform social norms in society through education and other information campaigns. We need economic empowerment initiatives for vulnerable groups and advocacy actions, amongst others. The health sector plays a critical role too when it comes to preventing and responding to domestic violence, and this is where our project, the ADVANCE study, comes to play. ADVANCE is an acronym for Addressing Domestic Violence in Antenatal Care Environments. Women around the world, including in Nepal where our project is based, use health services during pregnancy more than at any other time in their lives. There are also significant negative consequences associated with the experience of domestic violence during pregnancy, from placental abruption to early birth to as serious as death. At the time when the ADVANCE study was first conceived, there was very limited evidence from low-income country contexts to support antenatal care providers in effectively identifying and supporting women living with domestic violence in their clinical practice. In Nepal, as in many countries in the world, women rarely have the option to leave an abusive partner or an abusive family situation. So one of our objectives with the ADVANCE study project in its first phase was to develop a simple, low-cost, women-centered intervention where we could provide some safety, information, and education to women at their standard antenatal care appointments. So we commissioned a local artist in Nepal, Rashmi Amatia, to develop a pictorial flip chart of images based on an American safety behavior checklist for us to use. The pictures were of safety measures that women could potentially use during their pregnancy to reduce or to lessen the harmful impacts of violence experienced during the pregnancy. This feasibility study has paved the way for us to improve the intervention and to conduct a more rigorous scientific evaluation of its effectiveness. When the project's current funding finishes in 2025, our aim is to equip antenatal care providers in Nepal working in diverse healthcare settings with the tools to effectively identify women living with domestic violence and to support them in their safety, coping, and overall well-being.